No, I mean, I've said all along I didn't really like the idea of mandates. I don't think they're good to do on the vaccine. I mean, just for me personally, I'm not going to tell a female that's in childbearing years that may have apprehension about taking the vaccine that they got to take it. Now, others view that differently, but I think individuals need to make the best decision they can in regards to their health care concerning vaccines and certainly the pandemic. But I also don't believe that we need to have a dictatorship in government telling, local school systems what they need to do, what private businesses need to do, what nonprofits need to do, or what individuals should do. As someone that believes in individual rights and freedoms, I mean, that's what our country has been built on. But also know last year, working with the school systems and giving them local control and flexibility, they were able to figure things out. And that's exactly what we're doing this year. And this is not preventing anyone from wearing a mask if they'd rather do that or feeling comfortable, but it's not forcing a mandate that really at this point is divisive with our society. We should be focused on getting people vaccinated. That is the number one issue for me right now. Well, it depends on what states you're talking about, because we're not necessarily lagging behind others in the South other than Florida that has an older population. But you also got to remember, we specifically targeted our seniors early on, and we continue to get dinged for that. But I think if you look, that is the right policy. I mean, we're not having issues as much in our nursing homes and long-term care facilities. And where we are having those issues is because healthcare workers won't take the vaccine. So, I mean, I don't know if any government official is going to be able to talk a healthcare worker into getting the vaccine. I don't believe they're going to think that I know more than they do. But what we did was protect the most vulnerable so that we could keep our hospitals, keep these vulnerable patients out of the hospital, and that's working. I mean, people that used to go in the hospital with COVID would be there for 10 to 14 days. Now it's 2 or 3. Well, I mean, look, there's so much information on the internet that unfortunately some people believe, and which is why I tell them, look, you need to talk to your doctor. But I've also talked to, my dentist who told me, he was talking to a guy, and the guy just like, there's no way I'm getting the vaccine. And he's been treating this kid for a long time. So, I mean, you're just going to have people that have that hesitancy. We may never get them there. But I also think that the longer things go, there's more and more people waking up to that. I know for a fact 2 weeks ago, a couple I know, her son got COVID, got hit really hard. His mother and her friend had not been vaccinated, and he called her and said, you need to go get vaccine. This COVID's rough. And so you're going to have things like that happen. But the good news is we are seeing an increase in vaccines in the South, which is great. Tennessee's seen an increase. Texas has, Arkansas has, and certainly Georgia has, it to the tune of 66%. I mean, a couple of weeks ago we were happy we were doing 10,000 a week, and I think we did 20,000 last week. So we doubled the number of vaccines. And the point is, with the folks that have been vaccinated, the folks that have natural immunity from getting COVID at some point, plus those that are getting vaccinated now, I mean, every person that we get vaccinated, it helps us make it harder to spread. I do.